Hello everyone, welcome back to FACT Facial Assessment with Clarius Ultrasound. I'm Dr. Roya Zarmezami and in this episode I'm focusing on buccal fat pad, very important structure for midface volume and contour. There is a few treatments that using for buccal fat pad reduction, even surgical or non-surgical. It's very important to assess with ultrasound the size, position, and relation to the adjacent structures like parotid duct, facial vein, and all the muscles around. As we all know that buccal fat pad is surrounded by different tissue and structure. Posterior part, or we can say lateral part of the buccal fat pad is masseter muscle, which I'm going to scan and using as a landmark for scanning the buccal fat pad. Then medially and below, the deep part of buccal fat pad is Buccinator muscle. Superficial part is either Parotidomasseteric fascia or Risorius muscle, and sometimes we can find a parotid duct on uppermost part of the fat pad and facial vein in the lateral part of this fat pad. I'm going to assess the patient's buccal fat pad to see and why is important to assess, because some people they're not good candidate. It's good to explore the suitability for surgical or non-surgical reduction. If the patient has the thin and superficial fat pad, they're not good candidate and they might get injury to the very crucial structure, which is the vein or parotid gland. Let's start, and I'm using Clarius L20 for this part, and the preset is a static cheek area. I'm going, as I mentioned before, that I'm starting from the lateral part and masseter muscle. I'm asking the patient to clench, and you see the bulging of the masseter muscle and three heads. Posterior one is the deep one, superficial is the superficial head, and anterior one is the intermediate. Okay, relax. And now I'm scanning anteriorly until I get to the anterior part of masseter muscle. A little bit rotate and move superiorly. Now I'm asking my patient to animate again, below, and then you see the buccinator muscle become a very, very thin hypoechoic band. Relax. And then here, as you see, I can find the buccal fat pad. I will show you here. Most of the time, it's either triangle or oval shape, either a little bit hypoechoic or slightly hyperechoic compared to the adjacent area. This is the buccinator muscle, but this area that I'm showing is the buccal fat pad. And I can even measure the position from the surface to the deep tissue, which is 13 millimeter, and the thickness of buccal fat pad itself, which we have to measure the largest diameter of antero-posterior diameter to see the thickness of the buccal fat pad, which is 4.5. And then based on this, we decide to either do the reduction or not. either do the surgical fat pad reduction or non-surgical fat pad reduction. Now I'm going to do the color Doppler or power Doppler to explore the fascial vein, which is usually inside the coursing through the fat pad. I'm starting again from masseter muscle. As you see here, there is a bone. There is hypoechoic structure with hyperechoic band inside, which is deep inferior tendon. Then on top of the masseter muscle, you see the parotidomasseteric fascia as the multi-layer but hyperechoic layer, parallel layer, and then hypoechoic subcutaneous fat and skin. Now, with color Doppler, I'm scanning anteriorly and I expect to see the fascial vessels anterior to the masseter muscle in antigonial notch, but my goal is to check the buccal fat pad and fascial vein inside the buccal fat pad. You can easily see the fascial vein here, and then upper part of buccal fat pad, you see the very thin anechoic line, which is the parotid duct. If I'm slightly glide posteriorly on top of the vein or on top of the buccal fat pad, you see the Risorius muscle just extending from the Parotidomasseteric fascia. Today's scanning, I showed you how to assess buccal fat pad for the surgical or non-surgical treatment to ensure patient safety, to give the patient precise and safe treatment, or even exclude your patient from the treatment. Thank you for joining us for this episode of FACT. See you soon.